Hello, I am Cristina Marti-Amarista. I'm the Academic Chief Resident at the South Shore University Hospital Family Medicine Residency Program at Bayshore, New York. My co-author is Dr. Ruth Guevara, attending physician at Go Health, Northwell Health. We have nothing to disclose. We're going to be presenting to you approach to splinter injuries in the urgent care ER setting. Splinter injuries are commonly seen in urgent care and emergency settings, and they can present in different forms from new wounds to non-healing or infected wounds. Failure to diagnose foreign bodies has emerged as a common cause for malpractice actions against physicians. Hence, we propose a systematic approach for the evaluation and diagnosis of splinter injuries in the urgent care setting in order to decrease the risk of complications. Shown in Figure 1 is the proposed systematic approach for splinter injuries. It all begins with the complaint of an injury or the presence of a splinter. You need to complete physical and thorough interrogation, keeping in mind that up to 40% of cases of foreign bodies are missed on initial evaluation. On interrogation, you need to determine the nature of the injury. Is this blunt trauma, abrasive trauma, penetrating trauma? The timing, the material likely involved, and the tetanus immunization status of the patient. On the physical, it is important to determine the presence of injury tracts, bleeding, inflammation, draining sinus, granuloma, induration, or the signs of superimposed infection, like cellulitis, abscesses, osteomyelitis, and lymphangitis. If you were able to determine the presence of the splinter or the splinter is visible, you go to the next step, and that is to answer the following questions. Is this a highly reactive material? Is there any neurovascular or mechanical compromise or persistent pain or inflammation? If none of these are present, you can defer the removal and send the patient for surgical evaluation. If any of these are present, then you go to the next step, and that is to determine if there is any contraindication for removal of the splinter in the urgent care, or if there is any specific indication for surgical evaluation. What are the contraindications? Proximity to a vital structure, if you're unable to locate the foreign body, or lack of knowledge of the anatomy or the structures, the procedure, or the patient is unable to tolerate the procedure. What are the indications for surgical referral? A splinter in the face or deep spaces of the hand and feet or joints, if there is multiple splinters, and if there is any neurovascular deficit or an infected wound. If any of these are present, don't do the removal, refer the patient for surgical evaluation. If none of these are present, then you go to the next step, and that is to discuss with the patient the risk and benefits of the removal and to obtain a consent for removal. While you're discussing risk and benefits with the patient, you need to make the patient aware that there is always a chance of small undetected pieces to be left behind. For two reasons. One is going to make the patient aware of the importance of follow-up, and also is going to make the patient more aware that if any signs and symptoms appears later, they need to be evaluated because it may indicate that a foreign body was left behind. Once you start the procedure of removal of the splinter, you need to do it within 15 to 30 minutes in order to decrease the risk of infection and other wound complications. If unable to complete the procedure in 15 to 30 minutes, it's better to stop it and refer the patient for surgical evaluation. Now, if after a thorough physical and interrogation you were not able to determine the presence of the splinter, you need to answer one of the following questions. Does the patient have the suspicion of a foreign object present after a blunt or penetrating trauma? Or is there sharp pain with the palpation, a skin discoloration, tendon or nerve injury, a non-healing wound, a granuloma, a draining wound, a cyst or an abscess present? If any of these are present, then you have to consider imaging for possible hidden objects. Also, if the material involved is glass and the lesion is large, you also should consider imaging study to determine hidden pieces, hidden objects. When determining the material composition of the splinter, this is going to guide you not only for the expected reaction the patient is going to have, but also how fast you have to remove the splinter. As you can see here, organic materials like cactuses, thorns, animal spines, and wood, they can cause moderate to severe reactions that can go for hypersensitivity, increased risk for fungal infection, to toxic reactions. So they should be removed faster in comparison to glass, plastic, and metal that can cause a mild reaction and encapsulation that may facilitate their removal later. Also, determining the material composition of the splinter can guide you in the different imaging modalities that you can use to have a better definition of the splinter, the number of splinters, and also the location. As shown in Table 2, we compare three main commonly used modalities: X-ray, ultrasound, and CT scan. And as you can see, the material is going to determine the usefulness of this, and it can vary from good to poor. Shown here are the common splinter removal techniques that you can use. What is the post-procedure care for patients after you remove the splinter? So it's very routine wound care, and all patients should follow up within 48 hours after the splinter is removed. You may or may not use antibiotics, and the use of antibiotics has only shown to be beneficial in patients with delayed presentation, more than 18 hours, infected wounds, if there is any joint or tendon involvement, plantar wounds, retained splinters, puncture wounds, crush injuries, or immunocompromised patients. So in conclusion, you need to do a thorough history and physical examination when evaluating a patient with splinter injuries. The patient's suspicion of a foreign object, even in the absence of a wound, should always warrant further evaluation. Organic materials like thorns and wood can cause severe reactions, and inorganic materials like glass, metal, and plastic can cause mild reactions. Urgent care and ER providers should be aware of the indications and contraindications for splinter removal and when a surgical evaluation is warranted. I will add to this that always discuss with the patient that there is a chance that small undetected pieces may be present. So thank you very much. These are our references, and this is my contact information in case you have any questions or comments. Thank you.